I'm going to tell you something that you don't want to hear. Your body probably doesn't move the way that you want it to, or the way that it should. Today, I'm going to show you what a movement screen actually looks like, why we do it, what we're looking for when we do them, and trying to screen everybody that comes through our door to show them all their movement impairments and how we can correct these. So it's not just for rehab, it's not just for people getting into the gym, it's something that people need to be screened on for everyday life. Most people in the clinic come in and it is very consistent. People will come in, oh, my shoulder hurts. I don't know what I did. I just woke up wrong. Or my knee's been hurting for about 6 weeks. And every time I go up the stairs, I have low back pain every time I go to work and I sit for a long period of time. And nobody's really asked them, has anybody looked at your movement? Has anybody looked at your movement patterns, what you're doing, what you're compensating? And almost always the answer is no. I mean, they've went and got x-rays, they've got MRIs, they've got scans, they've been told that, you know, they have a bulged this or a arthritis, they have issues with inflammation, all these type of things, but none of them have actually looked at their movement patterns. A movement screen catches those compensations. As we evaluate, we're looking at your whole body with the movement screen. It's not diagnosing the situation, it's finding where you're lacking or finding the gaps in your mobility that may be causing or being the root cause of your actual injury or deficit. So today we're gonna go through what a movement screen actually looks like. And so for this patient here, I'm gonna have her just standing with her feet together and she is gonna look down. What I'm looking at here is if her chin touches her sternum or her collarbones here, and then she'll come back up. I also look at the spine curvature. If it's a very uniform or very segmental, I'm noting all this. So the next step, I'll have her look up towards the ceiling as high as she can, and I'm looking to see if she's within 10 degrees parallel with the ceiling, her spinal segmental curve, and then come back up, okay? And then now I'm looking at her rotation where she's gonna look to the right. I'm gonna look to see if she is mid-clavicle or beyond, if she's got some excess side bending at her neck, or if she's compensating some other sort of way. She'll come back to center and she's gonna look to the left. So we'll assess both sides, okay, and then come back down. And so now I'm gonna have her turn and we're gonna assess her shoulders a little bit. So she's gonna take her right arm and she's gonna go underneath and try to touch the bottom of her scapula there. So she actually has limitations a little bit there.